All right, I think we will start. Welcome everyone to the Center for Global Development for this discussion on fiscal policies for health. I'm Amanda Glassman. I'm the Chief Operating Officer here and a Senior Fellow. And this is a session on what just might be the simplest, most powerful intersectoral policy around taxing unhealthy products. And this is an idea that's getting traction due to the mobilization of civil society groups, health advocates in countries around the world. It's been supported by foundations like Bloomberg and the Bill and Melinda Gates Foundation. It's been informed by research at universities and at the World Bank. And here at the Center for Global Development, we've been making our contributions as well. But today we have the opportunity to discuss these issues because yesterday a new report was released called Health Taxes to Save Lives. So sometimes we talk about these as sin taxes, but no, they are health taxes, and a group of economists has rebranded this important idea. This is based on some work by the task force that was co-chaired by Michael Bloomberg and Larry Summers that looks at the enormous benefits to health that countries can achieve by raising taxes on harmful products more generally, and on tobacco, alcohol, and sugary sweetened beverages in particular. This process was fully managed by Bloomberg Philanthropies. They funded the effort, they put it all together. We were involved in different ways in supporting the task force, and very importantly through the presence of our president, Masood Ahmed, as a member of the task force, and our board chair, Larry Summers. But I think that it does represent a landmark call for countries to sharply increase taxes on tobacco, alcohol, and sugary beverages, especially in low- and middle-income countries. And before I turn to, I'll just introduce our panelists quickly, and then I'll give you 3 or 4 highlights from the report. So first we have His Excellency Dr. Amir Aman Hagos. He's the Minister of Health of Ethiopia. He is a medical doctor. He is our only health person, besides myself, on this panel. But he knows frontline what it means to deal with the consequences of consumption and exposure to these products over a long period of time. He's worked in all parts of the ministry. He is chair of the African Centers for Disease Control, which is a new and amazing organization that's helping in the fight against infectious diseases. And he's the co-chair of WHO's Transforming International Health Partnership for UHC 2030. So welcome, Minister. Thank you for coming.
Thank you.
Dr. Mauricio Cárdenas, he was a member of the task force. He's also a non-resident fellow of the Center for Global Development, but he's also the ex-Minister of Finance of Colombia, and he was incredibly the Minister also of Transport, Planning, Mines, and Energy. So he knows all of government, and he's an economist and authority who has done research, who has been at the Brookings Institution leading their Latin America program. Victoria Perry is Deputy Director in the Fiscal Affairs Department of the International Monetary Fund. The IMF is the organization that gives advice to low and middle income countries on their fiscal policy, on their macroeconomic frameworks, and it's really, really important that you're joining us here today. So we thank you very much. She joined the IMF in 1993. She's worked all over the world on tax policy and revenue administration. She's a co-author of a book, The Modern VAT. And previous to that, she was the deputy director of the Harvard University International Tax Program. So she knows what she's talking about when it comes to taxes, and we're really pleased to have you here. Masood, I've already mentioned, he's our president here at CGD. He has had a 35-year career working at the IFIs, including at the IMF, World Bank, and DFID. He was the director for Middle East and Central Africa. He oversaw the fund's operations in 32 countries. He's a great person as well. I work with him every day. So before we start, I'm just going to go over the big issues, and then I'll turn to our panelists. So these were the other members of this incredible task force. There were 4 heads of state. There were academic experts. There was a former director of the World Health Organization. But I think what is most noticeable is the high level and also the presence of fiscal and economic authorities. I think this is different from what we've seen before in conversations about these kinds of measures on taxes for health. So, economists often argue that consumers know best how to spend their own money and that governments should get out of their business. And so here we are with a group of many economists arguing that it is important to tax bads. So why do we argue that in the case of this report? Well, first, because economists do advocate for interventions where there are market failures. And there's a big market failure when it comes to the consumption of tobacco, alcohol, and sugary beverages. And that is that most people who consume them are unaware of, they routinely underestimate or are unaware of the huge negative costs of the use of those products over time. And it takes some time for the evidence on this to come through, but I think if you just look at the share of deaths attributable to just 3 products, it's about a quarter of all deaths in the world every year, 25%, okay? So that is staggering. Now, these are approximate figures. It's not entirely accurate to show it as a pie chart, but I think it shows the scale of the possible gains that we could achieve by reducing use. And mortality, or deaths, is only one part of this. There's also morbidity, sickness, and ill health. Now, obesity and diabetes have multiple causes, but added sugar is increasingly recognized as a major factor. And sugary beverages, again, are a small part of this, but an important first step to addressing the epidemic. The second big message from the report is that taxes are extremely cost-effective at reducing consumption of these products and saving lives. This is a graph from the Russian Federation that they introduced a series of measures to control alcohol, including much higher taxes as well as minimum prices. And what they found after they introduced alcohol control in 2005, these measures, there was a reduction in 1/3 of the consumption and about a 42% drop in the crude death rate per 100,000 population associated with alcohol use. That is an impressive result. The report shows similar effects of increased taxes in tobacco in Brazil and in Colombia that Mauricio will tell us more about. Same story, reduced consumption and increased revenues. There's also the story of a very important reform in Mexico that put a 1 peso per liter tax, a very modest tax, on sugary sweetened beverages in Mexico. And I should say, in Mexico, in the bottom 40% of the population, sugary sweetened beverages were representing 60% of caloric intake. Now, that's not true everywhere, but in a country like South Africa or Mexico where that is the case, these kinds of taxes, they shifted consumption and they raised revenue. Same story. So the task force concluded the taxes are a very effective but also very underutilized instrument to reduce consumption and improve health. In many countries, taxes are still extremely low, and sometimes products are becoming more affordable over time. So we need to look at this urgently. The next big message was about the kinds of arguments that are marshaled against health taxes. Now, industry opposes increased taxes with many arguments that we would consider false or misleading. The World Bank has just put out 2 really important reports. First, there's a myth that tobacco taxes are regressive. But what the World Bank found was that by looking at the lifetime effect of reduced consumption, these taxes are in fact progressive. The net impact of taxes over a lifetime means longer working lives, fewer days out of work, fewer families driven into poverty because of medical costs. The other piece that the World Bank looked at was the new evidence on illicit trade. Now, illicit trade happens. Okay, so this is a graphic of what happened in France when they increased taxes on tobacco. And, sales go down, and it does raise revenues as well, even with illicit trade. So per se, it's not a reason to oppose taxes. But what it is a very important reason is it is a very important motivation to revisit tax design, to look at simplification and enforcement. But it is not a reason to oppose taxes. Finally, the task force brought some new analytical work to these issues, and they conducted some simulations that looked at what would happen if if countries around the world increased their excise taxes on these 3 products by 50%. And what they found is that over 50 million premature deaths could be averted worldwide over the next 50 years. And they could raise over $20 trillion of additional revenues in present discounted value. So in a conversation on healthcare where we're always talking about domestic resource mobilization, this is definitely a win-win. And most of the lives that could be saved would be in lower middle income countries like Ethiopia, and as well as upper middle income countries like Colombia. So with that, let's stop, and I'll now turn to our panelists. And I'll start with Masood. You were part of the task force deliberations. What struck you as particularly important, or what was an issue that you didn't know about before, but that you really got into in depth that is possible to move the debate forward?
Well, thanks, Amanda. I would say, the thing that struck me by being on this task force, but also by getting involved in this issue over the past couple of years in a more intensive way, and Bill Savadoff sitting in the front row there, and Paul Eisenman sitting in the second row, were kind of instrumental in bringing me into that conversation, is how much of a disconnect there is between the people who work primarily on global health, and for whom much of this was self-evident, and the people who work on macro and fiscal policy, for whom much of this was unknown territory. And I really do believe that the value added of this task force, these numbers are compelling, but I'm sure that these numbers are not earth-shattering new information. They're just different ways of packaging stuff that people had been doing before. But the people on the task force were primarily people who had been involved in macroeconomic management and economic policy, and brought the perspective of the finance community on how to make the case in a way that could then get traction with that community. And there was a list on the first slide of the people up on the task force, and it's a very impressive group of people. So I think the first thing for me, the big learning, was trying to get a conversation between two communities where both could start speaking the same language. And I think there's a learning from that now in terms of going forward, and maybe we'll get into that. But I really do think the next step in this conversation is also, how do we manage to take this conversation out of the silo of the sort of global health community and into a mainstream, another silo, let's call it. Shows my bias, right? I'm saying the mainstream. Well, it's just the other silo, which is the fiscal conversations that are happening. In the 8 years that I was working on the Middle East, I used to get together with finance ministers individually very often, but collectively every 6 months. And we talked about many issues. And we talked about pension reform at times. We talked about environmental consequences for fiscal policy. But I don't think we ever talked about health taxes. And health ministers tend to think of the health sector, the finance ministers tend to think of the health sector as this black hole, which is just going to keep coming to me with a bill. I don't really understand it, and I can't say no to it because it's very hard. And there's a sort of reluctance to get engaged. But maybe what we can do through this event and following up on it is try and find ways to make that bridge a little bit more functional.
Mm-hmm. So Mauricio, you led really the increase in tobacco taxation recently in Colombia. It takes coalitions to get that done. Can you tell us about your experience?
Well, thank you. First of all, I'm delighted to be here. I'm delighted to be at the center, to be a visitor here as well. This is really the center of the discussion about development these days here in Washington. So very happy to be part of this. Great presentation, Amanda. I think we should just post this, send us the link We have to tweet this because in practice, this is becoming the launch of the report. There was no really formal event. It was just released in the website of Bloomberg Philanthropies on Wednesday or Thursday, actually. So this is a great presentation, a great way of summarizing the main recommendations. And I would just second what has been said, that this was bringing together two different constituencies that not necessarily speak all the time the same language, which is health and finance. I would say that the challenges, to talk a little bit about, every time, I mean, I'm a former finance minister, and as such, I write op-eds and I write commentary, and the first criticism that I always people make to me is like, why didn't you do it? Why didn't you just say what you did, what you're recommending now? Well, here's one exception where I can say, well, we did it, and we did it successfully. It's one of the examples that is illustrated in the report. Colombia rose significantly. We tripled the tobacco taxes, which is already showing the impact, which is a reduction in consumption, but at the same time, and this is why this is a win-win, increased revenues. And those revenues help finance the health sector. So you have, less incidence of diseases, but at the same time, you have more revenues that you can use to improve health outcomes. So it is a win-win. So you would say, well, why is it difficult then to get these things enacted? Why is it difficult to move this agenda? Why these things happen? I'd say I have to mention that the first person who created some awareness, at least in me, I wasn't aware of this. I didn't know about this. I'm very fortunate that someone mentioned it to me while I was still finance minister, was Mike Bloomberg. Because I came to Bloomberg in New York to give an interview about the exchange rate and interest rates and all of that. And he said, have you looked at the numbers on cigarette prices in Colombia relative to where they are in the Western Hemisphere? And I said, I have no idea. I'm not a smoker. I have no idea of the cost of a pack of cigarettes. And he said, well, it turns out that your country has the cheapest, second after Paraguay, which is a big producer, Paraguay. You have the cheapest cigarettes in the Western Hemisphere. So Americans now pay about $9, $10, even more in some states. In Colombia, the price of a pack of cigarettes was $1. $1. So, and here's one element of this report. The difference between $10 and $1 is taxes. It is taxes, it's nothing else. So I said, well, we have a problem. And we certainly had a problem because there's, of course, very significant consumption. Not as severe as in the Philippines or Indonesia, where 60% of the adult population are smokers, but we did have a problem. So we said we have to raise taxes, and we have to make cigarettes more expensive, at least $2.50, $3, which is still cheap, still very cheap, but it's a very significant price hike and tax increase. So what happened with the industry? And this is, I guess, I'm sorry I'm taking so long to get to to the nut of your question, which is what happened to the industry. So the industry, surprisingly so, we're saying, yeah, we understand that taxes here are low, but it's because Colombia has these borders that are so porous, and it's so there's so much contraband, and if you're going to raise taxes, you're going to get more contraband, and it's not going to solve your problem. It's going to make the illegal economy grow. It's going to make the informal sector grow. So we said, well, yeah, we probably have to do something on contraband. We have to acknowledge that there is a problem. So we enacted another law prior to the increase in the taxes of tobacco and liquor, by the way, as well. We haven't talked about liquor, but we did that too. Changing the legal structure and the institutional structure of the way we fight contraband. It's a different conversation, but we did that prior to this. And now we are able to say that we rose prices, the consumption declined, more revenues to the government of Colombia, and less, at the same time, less smuggled cigarettes into Colombia. Basically, and I'll end with this, contraband was thought of as a crime. It had been a crime, but it had been a crime with a much lower sentences and penalties and punishments relative to money laundering. And money laundering and contraband are really two sides of the same coin. I mean, the one way in which you bring dollars into Colombia from the illicit trade is by bringing goods that you sell in the streets. It's money laundering. It's contraband. So we say, well, the penalties have to be the same level. We'll treat these two crimes as if they were the same. And second, the smuggler is not just the one person that is crossing the border or the ship that is arriving to the ports, illegal ports, wherever. Smuggling is everywhere in the chain. So if you're selling smuggled goods, you're committing a crime. If you're transporting, if say a transportation company in Colombia that's just moving merchandise from one point to another, if what happens to be in those containers is smuggled goods, the trucker company and the driver are committing a crime, which is contraband. So that helped, and it basically improved the way we fight contraband. It helped us raise the taxes on tobacco and liquor as well, and that's why the whole package worked. So I'll stop here. We failed in some cases. We did fail. What was our biggest failure? Sugary drinks taxes. And that's a whole different conversation.
We're going to come back to that because I think, the other thing that comes out from the report is that tobacco and alcohol taxation in most countries are the biggest bang for the buck. The sugary beverages tax is quite important where consumption is very high. And we also have to think that the marketing of those industries increases over time. And it's likely that there'll be more consumption. So it's something to keep our eye on. But I think you tackled the high priority for now. Let me turn to Vicky now. So the task force calls on the international community and multilateral organizations to do more to promote increasing these taxes in low middle income countries. The IMF has published a technical guide on raising tobacco taxes, but otherwise it's a little low profile on this issue. So can you tell us what is the IMF doing in this regard and what more could it do in response to the task force's call for action?
Well, first of all, let me just say thank you very much for inviting me to be here. And let me give our usual disclaimer, which is that I'm not speaking on behalf of the executive board or management of the IMF, but I'm speaking from, as was kindly said in the introduction, quite a lot of experience with tax design and implementation at the IMF and elsewhere. So I think, first of all, I'd say we probably are doing quite a lot more, certainly on the tobacco and to some extent the alcohol front, than is apparent, because we do give a lot of advice in our technical assistance bilaterally with countries, which generally remains confidential as sort of trusted interlocutor for those countries. But we do very frequently advise that tobacco excises in particular should be raised. It can be a very, as was just pointed out, it can be a very good source of revenue. Just to take one example, as most of you who are into this topic know, the Philippines was rather successful in raising cigarette excises in a very difficult political situation, and we were certainly supportive of that effort at the time. And we do a lot of work with our member countries on the issues that were just, the very important issues that were just being raised about administering customs and tax authorities' ability to administer these excises, which is absolutely crucial. So it's certainly not that we are inactive or opposed to this effort at all. I think one thing I would like to echo what Masood was saying, which is our main interlocutors are well, for me, at least, the fiscal side, ministries of finance. And of course, they're more concerned with finance and the fiscal balances. And so, of course, one way to kind of sell tobacco excises is it's a good source of revenue. On the other hand, I think Masood's point that we really need a whole of government approach if this effort for health is going to be even more effective, involving ministries of health and ministries of finance, but probably in many cases going above the ministries and really encompassing the entire executive side, and if you want to pass laws, really the parliament in most countries. And there can, of course, be conflicts between the goals of all those ministries. I think I would say the same thing that's been said, that this report and this whole CGD effort to bring together economists with the health community is really important, because, I mean, a number of years ago at least, really the health community, I speak from the fiscal community. So the health community, in some cases, seem to have pretty small awareness of why some things don't work, what the actual results of some things would be, what could make these taxes work better. So not the idea on our side that these aren't good, but rather the idea that they should be made effective, and they need to have ultimately they need to have a societal imprimatur behind them if they're actually going to work. I think we'll probably come back to this later, but on the sugary beverage side, as you already noted, this is kind of a new area, and it's really quite, in various ways, different from the tobacco and alcohol area, I think, and I guess we'll come back to that.
Yes,
but
we'll come
I'll leave it there for the moment.
Okay, thanks, Victoria. Dr. Amir, Ethiopia has just passed a new and really strong law on tobacco control. And they've also just privatized the state tobacco company, which is a very impressive accomplishment. Can you tell us about the government's plans to raise taxes on tobacco, alcohol, or sugary beverages? And what do you see as the main challenges involved? Is the finance ministry a friend, an ally, a champion?
Yeah. Thank you, Amanda. And first, I would like to thank the working groups for producing an excellent document. It really, I'm the only one from HULS, in addition to Amanda. I can speak of all developing countries as a minister. This kind of document is very important for Minister of Health to have sit down and to have logical conversation with Minister of Finance and also the Prime Ministers or President level. So thank you so much for this important document. And I am very happy to say that we just passed one very strong and stringent proclamation about tobacco and alcohol 1 month back. And just to mention a few provisions, there are different provisions that really state that, for example, 100% tobacco-free public areas are already put in that proclamation. And it's also ban all advertisement for alcohol and tobacco, not only on broadcasting, but also on billboard, 100% ban. And also ban all heated tobaccos and flavored tobaccos, both e-cigarettes and shishas. It's 100% ban importing, selling, and manufacturing for these kinds of tobacco products. It also have some provision on putting some labeling both on back and forth, 70% pictorial labeling of tobaccos. And also it increased the sale age for tobacco and alcohol to 21. It was 18 earlier. It raised to 21. So it's a very strong proclamation, but we are still much far behind on taxing on tobacco and alcohol. My colleague from Colombia, he says that it's one of the lowest Western Hemisphere price for tobacco. I can say that Ethiopia might be the lowest in Eastern Africa, in the whole Eastern world. We can get, right now, you can get one packet of tobacco with only 70 cents in Ethiopia. So we have much to do. The excise tax is very, very low. And for alcohol industry, it's also the excise tax is very low. For example, last year, the total revenue generated from excise tax for alcohol, we have 10 alcohol industries all over the country. It was around $100 million, but we managed to collect $45 million from one tobacco industry. The tobacco excise tax is very low, but the alcohol is also much, much very low than the whole excise tax that we are making up. So we have much room for improvement. And the total domestic finance is very low, so we can really benefit from consumption reduction and also increasing the domestic finance. So last year, Minister of Finance and Minister of Health, we already agreed to commission to outsource a study of excise tax, and the World Bank did that. And they did a very fantastic job with robust excise tax, both for tobacco and alcohol. And I'm very happy that both Minister of Finance, the Prime Minister Office, and Minister of Health accepted that. And I'm optimistic within a very short period of time, we'll have very high excise tax, both on tobacco and alcohol. And we really want to continue to become a champion as Addis Ababa Action Point for tobacco. Our proclamation is a champion. I can, 100% with full confidence, I can say that. And we will come up with a champion for high excise tax for alcohol and tobacco. So the Minister of Finance is an ally. And with the new transition, with the new government, all ministries are working together in harmony, and the public is also an ally for us to really come up with this proclamation. The challenge is the industries. The alcohol industry, when we tried to pass this proclamation, they use many different techniques. They use celebrities for broadcasting because they really get much money from advertisement, to really come up with a very antagonized kinds of activities. And they use sport federation, for example, football federation. They sponsor a lot on football's alcohol, and they use not to come up with a broadcast ban proclamation. And they also use the Chamber of Commerce and also other mechanisms to really influence the government not to pass the alcohol proclamation. And also the private Japan tobacco industry is the one who privatized the whole tobacco industry. They use the already traditional reasons like illicit trade, employment, and revenue. In addition to that, they put some kinds of articles during the transition, during the privatization period in 2016. They just put one article that whenever the government want to revise policies or revise taxes, it should be with a conversation with this tobacco industry. But luckily, Ethiopia already accepted the Tobacco Convention, so we will not be governed by that rule anymore because we can't have a conversation with tobacco or industries as a government officials. So that's the challenge, but I'm very optimistic that with a new hope, with a new government, with a new transition, we'll have big and high taxes, excess tax, both for tobacco and alcohol.
Excellent. And I think, the other task force members can be allies as well, and I hope that you will call on them if there are issues that come up. Masood, so you talked a little bit about this, but health people have been working on this issue for a long time, and an evaluation of the Bloomberg Philanthropies tobacco work to date actually logged many successes, but the taxes were kind of the weakest link. Why do you think taxes aren't being used more aggressively? Obviously, industry, the reasons that you gave are prime reasons, but is there something about the way the global health community is communicating the message to ministries of finance that is a problem? What can we do to be more effective? Or what about the impact on jobs and growth, which is one that is often mentioned?
I think, and Vicky will have a view on this too, I suspect, as will Mauricio and others, but I think part of the issue is the one that I alluded to, which is that there just wasn't enough of a conversation, and it's always easier to do the things that are in your own domain. So if you work in health, it's easier to work on the regulations that your ministry can issue than to go out and make a case for an action that somebody else has to be convinced of and take ownership. And the taxes are going to be done by somebody in another ministry. So it's just that little extra step that makes it harder. And in the same way, if you look at health ministers or people who do development finance, the first thing they think about is, as a solution to any problem, is money. And that's, so you've got a tool, and you try to figure out how best to use the tool you're familiar with rather than to look and see which is the best combination of tools for the problem at hand. So I'm not saying it's particular to the health sector, but it's just a natural phenomenon. The second thing I think is worth thinking about is that the health people come and talk to the minister and say, look, you got to do this in finance. And then you get this delegation of the business lobby that shows up. And business lobby sort of reminds them of the impact it's going to have on jobs. And the jobs are going to be not just the ones of the people who work in processing, but in some countries it's also upstream if they're actually producers of tobacco, small farmers. So you bring in the small farmer gets hurt, bit, and then you start talking about it's going to really impact on the poor, because it's really poor people who are going to be so disproportionately hit, because the more educated middle classes are not smoking as much, and so now we're going to, and then you bring in the fact that actually I'm not sure how much taxes you're going to get, because all this stuff is going to get illicit, and there's this big growth in illicit trade. And then finally you sort of say, well, by the way, we are big sponsors of the sports team and of this and that, and suddenly we're going to have to cut back all of that. So that you kind of leave all this lingering stuff out there for you. And you're a finance minister, and you sort of say, well, I think it's a very good idea, but I'll kind of get to it later. And you never do. Because there just isn't the same kind of concerted, organized follow-up to help you implement the health tax. And I think if there's one thing we could do that would make it easier, is to actually equip the people who are promoting the tobacco tax, for example, to be able to have a follow-up meeting where they could say, by now I'm sure you've been visited by the tobacco lobby. By the way, here are some facts and answers, and this is how you can implement it, and these are the examples of other countries that have done it, and this is how you could sell your argument so that when you're criticized in Parliament for raising taxes on something that the poor consume, this is your answer. And I think you just need to kind of give them the support and the confidence to move forward. And that's where I feel there's the next bit of follow-up work that would be helpful.
Well, one reason sometimes, can I go back to you, Victoria, about the issue of earmarking? So, of course, in the health sector, we like to say that any revenues from such a tax should be plowed right back into health. But earmarking, obviously, for a fiscal economist is not the best way to go. So maybe if you and Mauricio could reflect on that. Some countries like Philippines earmarked for their national health insurance system, or Mexico also had an earmark, I think, into one of the Seguro Popular accounts. But what are your thoughts on that? Is that a winner or loser?
Well, as you said, your average fiscal economist, of course, is opposed to earmarking because theoretically and in fact it makes spending less efficient.
Yeah.
It reduces the choices to trade off where the best bang for the buck would be for the government. But I don't think a sort of soft earmarking, which doesn't either sort of legally bind everything that this revenue would be raised for, or I would say importantly, doesn't implicitly at least sort of cap the revenue source for the things that we all would like to see, more health spending on these diseases, and also sort of the regulatory side of stopping consumption. We haven't necessarily opposed that sort of earmarking. I think you do have to be careful what you're earmarking it for. I mean, there are examples where, as Masood was saying, an argument against doing, say, tobacco excises can be that if you're going to cover the entire market, meaning homegrown, sort of poor people, small farmer, local cigarettes, as opposed to international brands, it may have some effect. One must recognize that it may have some effect on labor in that sector. If it's going to be effective, presumably it will. But you do want to avoid earmarking, as we've seen in at least one case, where the earmarking was to sort of support and subsidize those workers, which is perhaps a political seller, but slightly defeats the purpose.
Yeah.
So it's a bit of a trade-off. I'd say, generally, you don't want to also run across, I already meant what I was saying, where you kind of have implicitly restricted your spending to the revenues, like the U.S. Highway Trust Fund, which, when it runs out of money, has to keep trying to find other money.
Exactly. Yeah.
To fix the highways. So it can be a political winner. It was in the Philippines. In fact, a bit of historical research, I think, shows that the way Brazil implemented its original value-added tax 50 years ago was by earmarking at least some of the proceeds for the health sector, interestingly. So that also raises a point that Masood was making. One thing that's hard about these taxes is they have very, very specific, wealthy, and targeted producers as well as consumers. And trying to raise a general tax rate is hard enough, but if you're trying to raise the VAT rate, lots of people may be opposed to it, but there isn't one single industry that is being actually targeted, which this, of course, does. And so that does make it easier to march into the Minister of Finance's office, for
Yeah.
sure.
Yeah.
So,
How did you deal with these issues in Colombia, Mauricio?
Well, I'd like to make 3 points. Point number 1 is if you divide the world in high income, middle, low, or high middle, low middle, and you look at consumption of tobacco, you look at consumption of alcohol, you look at consumption of sugary drinks, all the charts look the same. Mainly high income, consumption is falling, middle income is flat, and low income or low middle income, growing. That's where the market is growing. And the companies that produce this have that very clear. They know where their business opportunities are. So that means that this is a conversation mostly about development. This is a conversation mostly about developing countries. And there are 2 things that we have to take into consideration here. One is taxes are low, which we know. Colombia just gave a very good example. But also, incomes are going up in these low income or low middle income countries. So these products are more affordable. And that's what explains the increase in consumption. So taxation has to look into the fact that as time passes, there is more affordability. So therefore, there has to be a continued push towards the increase in taxation, because you have to look at the not just the absolute cost of this, but say how much it is in a percentage of your minimum salary or whatever. So you have to look at affordability. Point number 2. You're absolutely right, Victoria, about the fact that sometimes a general tax generates less reaction because everyone is touched by it, but so no one is saying this is unfair. I mean, it's not that it's easy. I had to raise the VAT from 16 to 19%. You know, it's not easy, but at least it's a conversation that you're going to say, well, this is for the good of the country because we need it. It's for fiscal sustainability. Everyone will have to put its contribution. So this is a very selective tax. This is one particular group of companies that, of course, are organized and have, structured themselves in a way in which they try to avoid this from happening. What I thought was the hardest, and this is the second point, is the local producers. So Colombia grows tobacco, and the tobacco producers are basically low-income rural workers. And they have a point in saying, well, what's going to happen with us? You're going to reduce consumption, but then you're going to affect production, and you're going to affect our standards of living. And that's a more difficult point, because then we get into a conversation about compensation, about ways to do some substitution in terms of the crops, etc. It's a much harder conversation. And I think you have to make some concessions in that regard. And finally, my third and last point. I guess the taxation of these products gets basically on the way of issues that have to do with the support that this industry provides to certain activities that are very visible. For example, the national soccer team. How do you deal with those issues? It's like, well, if you're going to tax us, we're not going to support the national soccer team. So, that touches everyone. And I think, this just happened in Colombia. And I'm going to commend the current government of Colombia, because they did that by doing something that should have done before, which is to extend the VAT for sugary drinks all the way to the retailer. The VAT in that case stopped at the plant level in the manufacturer. So you had to go all the way to the retailer, which it makes the tax more effective. And then one of the largest sugary drinks producers in Colombia said that they were going to stop funding the national soccer team. And the government of Colombia said, well, fine, they'll have to find some additional sponsor. So I applaud them for having done that.
Yeah, well, you have a very good team, so I feel like
Yeah.
someone else will support the team eventually. Dr. Amir, how is Ethiopia thinking about the sugar idea, the idea of sugar sweetened beverage tax, or are there other products that you're thinking are more important for health in your setting?
We are still trying to study the impacts of sugar, because the consumption of sugar in beverage in Ethiopia is very low still, because 85% of the population are still living in rural areas. But we are working with WHO and other stakeholders to really come up with a study what's the effects of sugar and also other beverages, especially sweet beverage, on the Ethiopian context. Immediately when we got that, we have a very good opportunity to pass any kinds of law, because of the private sector is not mature enough, and also the governments have very positive commitment for the healthy lives of the population. So we can come up with a regulation, proclamation, and some implementation of such kinds of activities. But right now we are studying the impact. But tobacco and alcohol, the effects already visible. That's why we prioritize tobacco and alcohol in the first place, but we are working on other products too.
And let me ask you about the earmarking issue that we just discussed in your setting. What are you thinking?
As Minister of Health, I really believe that earmarking of specific finance to health is very important, especially in developing countries, since most of Minister of Finances and others, they really think that health is overfunded due to very fancy workshop going on all over the world.
Well, that is kind of true.
Yes.
Can
So,
I
you know.
say something about earmarking?
Yes, go ahead.
So I like the
But we'll
point
let you come back to yourself.
I fully agree with the minister on earmarking, and I like the pragmatic approach that Victoria has endorsed. So there's earmarking and there's earmarking. So many times I was in the Colombian Congress dealing with tax issues, and for example, just give you one case. A group of members of our Congress said we should earmark the financial transactions tax, which is a criticizable tax for other reasons, but we have it and it collects quite a bit of money. We should earmark that to subsidize coffee producers. This is something that brings us together. We should subsidize coffee producers because, by the way, I don't know if you're aware of this, because I don't think you're aware of this, because the prices you're going to pay for your regular cup of coffee here in Washington have not changed. But the coffee producers in our countries are feeling a dramatic decline in coffee prices, which is now they're less than $1 per pound. But you haven't noticed that.
I haven't noticed.
You haven't noticed that. Anyway, so a member of Congress says we should earmark the financial transactions tax to give a subsidy to coffee producers. And I said, no way. There's no way. I mean, we need the revenues from that tax to pay the overall general budget of the government. There are many things we can do. Come the tobacco taxes, or sugar drinks taxes, or, sorry. Oops. Good. So, to make that bill more likely to pass, you say, well, what if we earmark whatever we're going to collect from these extra tobacco taxes for the health sector? So here's the order of magnitude. You're already spending about 5% of GDP on health. That's basically what's in the budget. And this is going to generate, at best, 1/10 of that. So you say, well, yeah, I mean, we're going to pay 5% of GDP anyway on health. If this helps us collect 10% of what we need, it's not going to hurt anyone, and it's going to make this more appealing to people that have to vote. Because they're going to say, well, yes, I mean, we tax tobacco, and at the same time we get some revenues that we're going to use for the health sector. So that's what I say. There's earmarking, and then there's earmarking. This is soft earmarking. This is earmarking revenues that are a fraction of what you need for certain expenses, and it makes the case a lot stronger. It helps round the package in a way that I fully support what the minister said, because I think it just makes a lot of sense.
And Victoria's point is important, which is that, okay, when revenues are growing, maybe your fund is full and life is good, but these are recurrent cost requirements in the health sector. You don't want to earmark, because the earmark goes up and down too, or just down. In the case of, if we're successful at reducing consumption, that source of revenue will also fall. But go ahead, Masood.
So I just want to kind of make a point, which using the earmarking conversation we've just had to broaden it out, to say that, you look at the literature and the objections around taxes on tobacco, and essentially they're all raising problems at the margin, right? Basically, if you can get 80% of what you want, then go for it. Yeah. So, earmarking in principle, not a good idea, but if you can organize it in a way that is not damaging, go with it. And I think you'll see that maybe there's going to be some leakage in terms of people who are going to increase smuggling. Well, maybe look at the numbers. If it's small, live with it. So I think my basic message on this is that I think we need to move away from a theoretical argument about the marginal potential problem to broadly, what are we trying to achieve, and does this broadly get us there? It doesn't mean design the thing wrong so that you actually end up with the wrong outcome. Mm-hmm. But if you broadly got it right, then in this area, as in most things in life, getting 80% of the way is not a bad place to end up.
Yeah, and it is the huge number of lives that can be saved from it when you compare it to other possible ways to spend your time or do policy are so massive that it's really an under-invested opportunity. So maybe with this, we'll take some questions from the audience. I'll take 3 at a time. Please say who you are and where you're from, and then we'll ask our Sanjeev. Wait till since we're webcasting, we want our online people to hear you.
Thanks. Just 2 questions for Mauricio and for the minister, and one question which is a general question, any panelist could respond to it. One is, when you were raising taxes in Colombia, did you look at the regional context? And the same thing applies to Ethiopia. Are the taxes low compared to all countries, neighboring countries? Because this is an issue which comes up for the illegal trade. So that sets some kind of boundaries, how far you could go. And the second question, which I think which is being discussed in another context, is the impact of these excises on the poor. What is happening is, in some of the countries, the studies which have been done by Commitment to Equity Group, Neuralistics Group, shows that the cash transfers from the poor as a result of high excises are more than the transfers that the poor are receiving from the government. So the net impact is poor are becoming cash poor. So the point that I'm trying to raise is, how do you see this? Because some people in that group are arguing lower the taxes, but that goes against the argument of having higher taxes on some of these sin goods. Mm-hmm. But this is having an impact on the cash balances of the poor. So I think one needs to understand, look at that context. And this is a bigger debate which is happening in the other. And finally, you talked about earmarking and raising. What was the impact in terms of fungibility? Because ultimately, when you raise the taxes, something else goes away. As a minister, you know the fungibility concept very well. So so it doesn't necessarily increase the net revenues for the health sector.
Okay, over here.
Thank you. This report is terrific, and strongly encourage those of you who picked up the background papers to read the background papers, because they're also equally terrific. My question is about sugar-sweetened beverages. We didn't actually get into the sugar-sweetened beverage tax, and I think, I don't know if it was you, Masood, who said it's sort of a different conversation altogether, or maybe it was Mr. Cárdenas. But I'd love to unpack that a little bit more and get your reflections on why that's a sort of a different animal. Of course, nobody needs alcohol, really, nobody needs tobacco, so those are a little bit more clear-cut. But when it comes to sugar-sweetened beverages or food and beverage companies and the role of unhealthy foods and beverages in one's diet, I think, and the question of taxation, that becomes sort of a little bit tricky, so I want your reflections on that. And then one quick question on the raising of revenues. Presumably, if consumption is going down, eventually revenues will start to come down as well. So how sustainable is this revenue stream that we're advocating for? Thank you.
Okay, Rena back here, and then we'll come back to you.
Hi, Rena Eichler from Broad Branch. Just wondering if there are estimates of the proportion of the sort of health sector budget that actually can be raised through these excise taxes. Like how much bang do you get from this? Thanks.
Okay, that's a set of really good questions. We'll come back out to you in a moment. So let's start with you, Dr. Mir. Why are you alluded to this a little bit in your comments, but tell us a little bit about why sugar-sweetened beverages is a different conversation. And also, Masood, if you can reflect on that, and well, really all of you. I think that's a very important and challenging question. I mean, one thing that's very clear from the evidence that the task force looked at was that where consumption of sugary sweetened beverages is high, the tax reduces consumption. That is very clear. The issue is, okay, well, that's only one part of the dietary challenges that most households face that are, engaging those kinds of practices. So it's a first step. It's not a comprehensive solution in the sense that reducing tobacco consumption or alcohol consumption is. But what are your views on all of these? And then, I'll prompt you if you forget the questions, but we'll just go this way to answer. Go ahead.
Thank you. The health impacts of sugary and sweet beverage is clear. So as Minister of Health, it's not about the science and the logic that we put as the secondary issues compared to alcohol and tobacco. But first, the penetration and the access all over the nation is very low. Access to sugar and beverage, access to the communities, because of 85% of the population are living in rural areas, it's very low. And also processed kinds of beverages, also the penetration is very, very low all over the nation. We just got one food chain, the fast food, I think it's last year. There was no any fast food in Ethiopia for the last, hundreds and thousands of years. It's just, the market is coming just yet right now. We are enjoying injera, the traditional food, with gluten-free and it's sugar-free and any kinds of calorie that we can say. But now it's emerging. So we should really have to see how we can come up with a proclamation and regulation and how we can implement in practice for the already seeing emerging markets in Ethiopia. That's why we didn't come up with some kinds of stringent proclamation yet. Second, the household calorie intake in some areas is mainly depending on sugar. Especially we have around 1/3 of the whole geographical area is a pastoralist area. And people are nomadic, they are moving from one place to another place, and they only carry sugar during the whole journey that they are making. Maybe 3 months, 6 months, they travel from one area to another areas to get water for their cattle and herds. So we also come up with some kinds of innovative ideas how we can subsidize, as it's mentioned earlier, before we come up with stringent proclamation and regulation for this specific area. So these are the two major reasons, but we are working on it. It's a work in progress that will come up, later.
Okay, great. And on the question of, did you consider your neighbors when thinking about increasing excise taxes?
Yes. Our excise tax is very low, even within the neighborhood countries, both IGAD countries, East African countries, and Horn of Africa countries. It's very low due to different reasons. So we really feel like by only implementing excise tax on tobacco and alcohol, we can increase the total GDP health expenditure by 1%. Right now, we have a total GDP expenditure for health is only 4%. So we are estimating that by only having high taxes on alcohol and tobacco, we can increase 1% margin for health expenditure. So we already assess the whole neighborhood excise tax, and it's one of the lowest that are happening in Ethiopia.
Yeah, I was going to weigh on this. Absolutely, these regional issues are very important. That's why the report emphasizes the need to do this everywhere. The WHO has been working along the same lines, because the more you have coordination, the more effective the taxes are, and the less you have to deal with these issues of contraband and all of that. So some coordination is necessary. It's not that it's a prerequisite. It's not that you can't do anything if your neighbor is not doing it, but it's much better. And can I touch on another topic that a couple of topics that were mentioned here? The distributional aspects are very important. We didn't mention that. I'm glad you asked that question, because when you look at the effects of this in terms of the different groups of the population, you see that for the groups that are at the lower end of the distribution, you have a more significant reduction in consumption, and you actually you release some expenditures that can be used for something else. I mean, people just don't consume, therefore they're not paying taxes, so this is not really increasing their tax contributions. Whereas in the upper end segments of the population, you have a lower reduction in consumption because there is less elasticity of demand, so people reduce their consumption less, and therefore they're net contributors from the point of view of taxes. So distributionally, this makes a lot of sense. It actually makes people with higher incomes pay, and the people with lower incomes save. Actually, they end up saving money because their consumption really falls. So this is a very important element. We hadn't talked about this in the earlier part of the discussion. I think it's crucial. And orders of magnitude. I mean, does this really help fund your entire health sector, these excise taxes? No, I don't think you can actually fund all the expenses associated with health with these excise taxes, but they contribute. And they do contribute, but this is very specific to each country, but the responsibilities between the national government and the state level governments are also a part of this discussion. And the more you do to help state level governments have the funding for health, the better. So some of these taxes, for example, tobacco, liquor, are taxes that in our case in Colombia are decided at the national level, but the revenues go to the states. And for them, it's very important because with this, they can actually pay some of the health bills. So that internal conversation between different levels of government is also very important.
Victoria, what about this issue of the neighbors in the regional context and thinking, does the IMF have some role there, do you think?
Well, certainly that's when I say we work with countries on their implementation and their administration issues, that is a key point. And definitely there are smuggling issues. Colombia was in the, I wouldn't say fortunate, but the position of being the low tax country. But when you become the high tax country, then you are going to see smuggling. And cigarettes are really quite easy to smuggle. Big sets of bottles with liquid are harder to smuggle. And I don't think most of the contraband and counterfeiting issues with alcohol are quite so much about moving things across borders as they are about fake branding and failing to pay internal excises. But yes, we definitely work on all of those things, and it's very important. In terms of the distributional aspects, I guess a couple points. One is you're going to have poor people who respond with a high elasticity and just stop consuming, as the minister was saying, which is sort of the goal. But you're also, within that set, no matter what the average is, you're going to have poor people who don't stop consuming and rather shift their small amount of household funding towards cigarettes because they're going to smoke the same amount and it costs more. And ironically, this is sometimes a gender issue when we talk about gender, fiscal issues and gender. One would think that this was a problem that was kind of with a pro-female bias because women smoke much less in most countries, not every country, and drink much less. So that one would think, well, it's coming up, it's affecting adult males more than others. But in fact, it is sometimes argued, and I don't actually know the statistics on this, but it is sometimes argued that it's also adult males who control the household budget everywhere. And if they're going to keep smoking the same amount, that means there's going to be less money for the mother to buy food for the children. So that's only by way of saying there can be untoward effects here. I was thinking when Masood was speaking about earlier, and the minister, about small, low-income producers not in the advanced economies, but in low or lower middle income countries. Probably, if you're talking about consumption, then we're talking really here about internalities, not externalities. And that was one of the things that struck me about the whole report. If you're actually going to try to measure the externalities, the economic externalities from the consumption of tobacco and alcohol, you're not going to come anywhere near the numbers that are being talked about here. And really, the term internality was coined sometime 15, 20 years ago by a couple of economists to mean, in a sense, what we might call paternalism. That is, internalities being people do not understand. It's impossible for the human animal to envisage how they're going to feel about this 25 years from now when they've damaged their health. And that being the case, worrying about whether it's regressive with respect to their consumption is a bit counterintuitive also. That's the whole point. But with respect to the people that are making their livelihood by producing these things and are also very poor, I think that's a very good case, as Mr. Cárdenas was saying. You may have to think about sort of subsidizing those people. You don't want to subsidize tobacco consumption for the poor. That's exactly the wrong approach. But you may have to do something. It's like the effects of trade. Everybody, globally, we're all winners, but there's a few people who are losers. And maybe the world hasn't thought quite enough about how to handle that.
Yeah.
And finally, just to say on sugary beverages, and I don't want to take up everybody's time, but obviously it is a different question. Sugary beverages themselves are a consumption item, like tobacco or alcohol, although they have a lot of substitution issues that we're not fully apprised of yet, I think, as the report quite logically points out. Once you talk about what you were raising, the audience question was raising about food more broadly. A lot of food's unhealthy if eaten in sufficient quantities, but usually those same foods are actually needed. And I think the point about marching across Ethiopia carrying sugar is an incredibly good example, a very stark example of that more than most things. Once you get past the consumption item of soda, shall we say, sugar and fat, they're inputs. It's much harder to impose something that's really an excise tax on an input. It doesn't sort of economically make that much sense in a way. We see that in the carbon case too, of course. So that's not to say it's impossible, but it's a much more complicated and less clear-cut case, I think, these food taxes. I had an innate prejudice that, of course, we should do food taxes. Everybody eats too much. Coming from a rich country, I can say that. It's not really true in the poorest countries.
Right.
But it turns out not to be quite. We've done some studying of this, not direct studying, but at least literature searching, studying, just as this report does. And it's a less clear-cut case, I think I'd have to say. So if I were going to advise a minister on what's your biggest bang for your health buck and where are you going to get the most money, I think the report would still come out and say it's still tobacco, actually. And there's really not too much good you can say about consuming tobacco.
And alcohol.
So,
Well, can you talk about the task force? Yeah, we can discuss that.
yeah,
that.
I was going to
What
come.
does the task force talk about, and with reference to sugary sweetened beverages and these kinds of issues in general?
I think we had a long internal conversation in the task force about how to deal with sugary beverages. And it is a more complex chain of reasoning because, first of all, the numbers just from sugary beverages are smaller than say, tobacco. Or secondly, there's the argument of sort of how do you go from there to making the broader point? And it's really, when you look at the numbers, we're talking about obesity and diabetes, and there's other factors that feed into that. So, and I think then there's a third point, which is, we're talking a lot about taxes, because that's sort of been the underutilized tool in this conversation. But there is a complementary conversation about what I would call the sort of enabling environment for you to be able to impose taxes. And today, on tobacco, there is an enabling environment that essentially makes it a question of how you go about it, because there isn't really much debate about whether or not it's a bad thing. And you can no longer, I'm old enough to remember the time when in this room we would have been having this conversation, and a quarter of the people would have been smoking while we would have been sitting here, and the others would kind of been waving it away, but would never have thought that they could actually stop someone from smoking and blowing smoke in their face, because it was kind of like accepted. Now it's not. And so I think the enabling environment is something that it isn't quite as ready yet for sugar as it is for tobacco, and as it is for alcohol in many ways. So that's kind of one point. Second thing I wanted to say is Sanjeev's point about fungibility. And of course, that as economists, we sort of all believe in fungibility. And in some ways, in this case, fungibility is good, because if it really doesn't change the health budget, from a finance minister point of view, I'm kind of relaxed about it, because my view is I didn't want to change the health budget. I was only doing this to get the tax through. Now, I'm not sure the minister's going to be happy about that outcome. But, with small amounts of money, frankly, I don't care what you call it. Where it comes from, and I just want to look at the big aggregates, and if it doesn't shift it, it's okay. I'm more worried when actually targeted funding starts distorting spending by changing not the health budget in the aggregate, but subcomponents of the health budget. We can have a separate conversation here about how a lot of donor funding has actually changed the pattern of health spending in countries in ways that are different from what those countries would have done. And, is it good, is it bad? We can have a discussion. And then the last thing I wanted to say is that, this question of looking at your regional comparators, there's a parallel, which is now you can, on your phone, get an app that gives you the air quality index in every city and in your city, and actually on different locations in the city as well, at any time. And what I've seen is, I was in Lahore recently, in Pakistan, which is now, I think, the second most polluted city in the world or something. And the number of people who are citing the data from that comparator to say, we're worse than Beijing, and then, we're worse than, actually helps to create the enabling environment to do something. So I'm sort of wondering, and maybe somebody here will know the answer to this question, is there a place where you could go and you could click onto your little phone to be able to see what is the tax rate for cigarettes in your country, and how many people die of smoking in your country? Just those two numbers, your tax rate, how many people die as a share of the population, and be able to compare where you stand with everybody else. Because it would be quite a useful way of trying to get a more popular conversation going beyond the technical community, to build that enabling environment where people would say, gee, you know, we have a pretty bad record on the number of people that die from smoking here, and we're also very low on tax rate. So maybe there's a connection, you know. So I kind of think maybe we should think about not just a regional comparator, but this could be a follow-up project for the Bloomberg Philanthropy. And here's a message to Joe Brickmeyer, you know, who's been our counterpart on it, to get this going.
Okay, I'm sure Joe is listening
Yes.
to us now. Do you want to say anything about?
Yeah, I'd like to take this issue of following what Masood just said about the sugary drinks, because consumption of tobacco is always bad. It's an easy argument to make. Taxes in some countries are very low, so consumption is growing in the low-income countries of the world. So it's a very simple way of making an argument. So what about the sugary drink? So the Mexicans who have basically studied this, there's a group of people in the health sector in Mexico, have found very positive and interesting results after the introduction of the tax. The tax, Amanda said, is 1 peso per liter, which adds to about 10%. That's more or less the tax of the sugar drinks. And what has happened is that there's been a decrease in the consumption of sugar drinks, especially in low-income households, and increase at the same time in water. So that's good. I mean, if you can introduce those shifts in the population, that's good. And this brings me to a question that is a very interesting question, and I could organize a whole debate in the future. Victoria alluded to this. This is not so much about the externality. That's the way we are trained as economists. We say, well, if you consume sugary drinks or if you consume tobacco, that's bad for everyone, that's bad for society, we have to intervene, we have to put this tax. So this is not so much about that. This is more about, are we fully rational in the decisions we're making? And if not, if for some minute we grant the point that we're not fully rational in some decisions, there is some role for the state to come in and say, you know, I'm going to send you the price signal. So with prices, I'm going to try to change your behavior a little bit. And that's, I mean, some people characterize that as the state playing a patronizing role, and but it may be good for us if we make decisions that are not fully rational. And sometimes we do that. Sometimes we don't fully internalize, that's the term, the consequences of our actions. But this is the world no longer of the economists. This is the world of the philosophers.
Psychologists.
And psychiatrists, and well, some behavioral economists.
Yeah. We've got a lot of stuff out there basically now demonstrating how people's behavior is influenced in ways that, you know, is a function of stimuli that they get. So how
But
many
what I
people in
mean,
this room
no.
believe that we're fully rational all the time?
But what
You
I
know?
mean is, I'm fully in favor of the idea that if this is good, if this is bad, and it generates some addiction and dependence and habits, even just a habit, state may come in and say, you know, but there's some people that say, well, that's too much a role for the state to take. And that's where I say philosophers discuss that.
Let's go to the far back, and then say who you are, please.
Greetings. Can you hear me? Yeah.
Yes.
So my name is Damon Ansel, and I have the privilege of serving as the Corporate Affairs Director for Diageo, which is the largest producer of alcohol. I know we don't agree on everything, but thank you for allowing me to speak. Ironically, we acquired Meta Abu breweries in Ethiopia, and the alcohol sector, the formalization and sale of the alcohol sector has realized over $1 billion in investment in Ethiopia. I'm not going to speak to the areas we disagree, but perhaps a couple areas where we agree. First, I think that involving the industry would be a good idea. I think we have some areas of agreement, in particular on the area of structure of tax. As the report indicated, South Africa is the only country in Africa that I'm aware of that taxes the harm component, which is ethanol. Most other countries have an ad valorem tax structure, which incentivizes low cost, low price, high ABV beverages. So I'd like to hear what your views, particularly in Ethiopia, as you talk about tax reform. This is something we support, about a structure on alcohol content.
Thank you.
The second comment, quickly, is the irony is that many governments are coming to us, asking us to create liquid that would tackle the cost and cause of the disproportionate harm caused by the illicit sector. Whether you believe it or not, countries and where we have brands that meet those price points. And the trade-offs that they offer are actually, ironically, tax concessions for us to be able to get to that price point. So I guess the question there is, what do you think the role of the companies like ours is in formalizing the informal? Do we have a space or a right to play in that area? Thank you again.
Okay, thanks.
Thank you.
The woman right in front of you.
Hello, my name is Rebecca, and I'm an intern with Results for Development, and I was working on nutrition financing and looking at domestic resource mobilization for Malawi, and we're thinking of like the soda tax to help fund like nutrition programs in Malawi. And so I'm really glad you mentioned the water consumption with Mexico, because I had a question related to that. And my question is, so in the whole idea of we increasing tax on soda is also to help people to consume more water or probably milk. But in areas where, especially in low middle income countries, where there's problem with access to safe drinking water, how then do we kind of like try to solve a problem without really creating another problem? Because in the case of Mexico, they did see like a 10% increase in gastrointestinal diseases with the sugar tax after that. And so my question again, like, is how do we solve one problem without creating another that could be a burden on the health system? Thank you.
Great point. Okay, and let's go for I'm going to ask Paul Eisenman because he's a leader in this field right here in the second row. And we'll have time to talk with all the panelists when we finish. We'll do a final round.
Thank you very much, Paul Eisenman, an independent consultant now. First, I really like to thank the task force and those Bloomberg who financed it. And I think the report that we've just seen is really pretty good. And also thanks to the panel for I think a really good presentation. And lastly, thanks to Bill Savadoff and to you, Amanda, and to Masood, who have played a very, very active role in this task force. I think it's a big step forward. When we're talking about, well, we're not quite sure what to do, I'm struck on page 6 of the report in bold print. It says 8 million people die each year from tobacco use or exposure, and almost 3 million people die each year due to alcohol consumption. And we know that raising taxes can really help save lives. So we ought to be willing to put up with fighting, take on fighting the industry, the two industries, in order to move in that direction. We've talked about earmarking. There was a conference that Masood spoke at of the World Bank about a year and a half ago, a whole bunch of country cases about political economy. Almost every country said, we couldn't have done this if we didn't tell people that we'd use most of the increase in the taxes for something that people really want. It usually was in health. So yeah, as Masood said, it's not the fungibility that really matters in this. And we talk about, this is an unreliable source of taxation, it's going to go down sometime. thing is, we don't know of any countries where that's happened, except for
yet.
a couple of
Nordic.
very high income countries. And when that happens, you know, if other aspects of your tobacco control program are working really well and consumption's going down, don't be so sure that raising taxes isn't going to raise more money. We actually don't have any evidence where increases in taxes have reduced the amount of taxes collected. So, but I would like to ask the panel, anyone who wants to comment on it, if you, given what we see now, we know what's the right thing to do, we know the obstacles, what are the two most important things that can be done as a part of the follow-up of this report to accelerate progress on a path that's pretty clear?
Okay, great. That's a great set of questions to end on. So maybe you'll be the last word. So get ready. We'll start with Masood. The two most important things: what to do about places where drinking water isn't safe. What about industry involvement?
I think, first of all, the industry involvement point in sort of dealing with the informal sector, which is particularly important in alcohol. That's really where we're focused. I think it's a good point to raise, and it's something we need to think through, because what you want is to move away from the informal production and safer formal production, but at the same time you want to be able to reduce overall consumption. So the question is how you can raise prices and do it in a way that doesn't shift the consumption pattern towards the informal. And that's something to think through. I would say that I'm not so sure about the. You cited the evidence on Mexico that about where there was a consequence because the water wasn't safe, the drinking of the water. But I mean, I'm kind of not so sure what is the counterfactual here. Like, were they not drinking water before? I mean, so I'm kind of wondering whether that's a good enough reason in itself. You got to deal with the water problem, but I'm not sure I would use that. It's one of these arguments which kind of is true in itself, but it's not a good reason to hold up something else that you want to do, which is probably better. So I think we just need to sort of work that through, I would say. And then, what are the two most useful things? I think the most useful thing we need to do now is to follow up on what is essentially a document, which is a report, with some program of outreach that actually translates this into a country-specific conversation, because nobody's really the end. I mean, these are all nice big numbers, but at the end of the day, for each country, you got to look at what their taxes, what their numbers are, and then have a program of engaging with finance ministers in a much more systematic way than has been the case in the past. If you believe the theory that one of the reasons why we haven't acted is because there hasn't been that connection, well, now we have some compelling evidence, but how do you actually make that connection? That, to me, is the biggest thing we could do.
Victoria?
Well, I guess I'd agree with Masood's first two answers on the first two questions, for sure. I think, and I'd also agree that the way the taxes are structured on alcohol and tobacco make a huge difference in what the impact on the market structure is. And yes, I mean, there certainly were issues. I know we had the evidence on the slide of Russia, but there were obviously early on in the 90s, at least, when just incomes fell, there was a huge set of deaths from bad alcohol. It wasn't ethanol, basically. And similarly with unsafe drinking water, there may be, as you were pointing out earlier, there's at the margin and there's a fundamental problem. Clearly there's a fundamental issue with drinking water in many countries. But the difference at the margin between switching from soda to water is probably actually a rather small, I don't know the numbers, but one would think, especially in an extremely poor country like Malawi, where most people probably really can't afford much soda no matter what they do. Mostly they're drinking bad water anyway, and we need to really focus the international community on doing something about the water. I think it's almost a second question, and an extremely important one. And in terms of what could come out of this, I think aside from taking this kind of evidence-based approach on a country-by-country basis, hopefully using some people like ex-finance ministers who can say, look, this was important, this really works. On the tobacco side, at least, that's probably important. But I would say on the food and sugar, on the sugary beverage side, looking more carefully going forward, almost as a separate project, on evidence developments that are happening. We do have now more. It's very recent, the implementation of these taxes in a few countries, but at least a couple of the Gulf countries have just implemented such taxes, and those are, of course, pretty high-income countries. So we'll see what happens. That'll be some evidence. We should do somebody should do some studies at starting on the very ground floor of those countries, I think. Yeah.
Okay. We'll reconvene here
Yes.
in another 6 months' time. But go ahead, Mauricio.
But I fully second what has been said. I guess I'll just add in the direction of the question that was asked about the priorities. I say it's clear from this audience, from this conversation, that there is a clear understanding, at least the way I see it, that tobacco taxes are still low in many parts of the world. So this is essentially a good starting point. Let's increase tobacco taxes. I don't think there'll be much doubt about the benefits of that. The more countries do that together at the same time, the more effective it will be. I guess from this conversation, we can make some concessions in terms of earmarking. So I would start there. I think that's essentially in my view, an only gain decision. There's no cost. We can discuss about other things. We can discuss about the sugar drinks. We can discuss about liquor. But that, to me, it would be just great if, as a result of this task force, the world in general raises tobacco taxes.
And what do you think that we could do next to move this agenda forward? Should we deploy you to
Mauricio's
a SWAT team of ministers of finance?
I guess.
Mauricio project.
Yeah, well, the report was just launched. I would say that we should basically get together the health ministers, the finance ministers, and have a conversation with them and say, well, these are the consequences of this. Some examples of where this has worked relatively well, and maybe some finance ministers will see an opportunity. Every finance minister is looking for ways in which to raise more revenues, and maybe they just haven't seen the opportunity there.
Okay. So, well, I still like the Minister of Finance SWAT team.
Uh-huh.
So, okay, Dr. Amir, why don't you finish what would be most useful to you as you're facing these decisions going ahead? What are you looking for from the international community?
Thank you. Before that, let me answer one of the questions asked
please.
by brewery company. In Ethiopia, 20 years back, the whole brewery company was government-owned. There were 3 at that time. Right now, we have around 11 brewery companies. Most of them are international. 90% of them are become international brewery companies. And the whole production are growing. Still, the consumption rates of alcohol and brewery in Ethiopia is low, but the market is growing very fast. And when we passed this proclamation, there was a discussion with the brewery companies, and it's obviously that there are some places that we can't agree on. So we can continue with agreeing with disagrees and to protect the community at the highest level. So the excise tax that we are planning to implement very soon, it's not structured. It's not only for it alone. It's for the whole brewery package due to different reasons, the capacity and the other issues. But just to mention one of the impacts of brewery in Ethiopia with the water consumption is very high. There is one place in Ethiopia that's a brewery company named after the name of the places. In that area, the cost of water is much expensive than the cost of brewery because the brewery companies own the whole water source of that specific areas. So communities living in that area, it's very easy for them to buy alcohol, beer, than buying 1 liter of water at that specific areas. So it's not only about a matter of health, but it's also a matter of justice and providing equity for the community. So, but still, we are believing that there is a conversation going on, and we'll participate the companies on next endeavor. So as an Ethiopian, we really need international community to support us on capacity building or regulation. Passing a law is one thing. It might be the easiest thing, but enforcing law is very, very difficult. So especially for developing countries, low-income countries, that our regulatory bodies are not as mature as the private sectors, the contrabands, and also other very highly technical issues, taxation issues, and others, very difficult to enforce the already passed proclamation. So we still need much support from international community in our strengthening the regulatory parts of aspects. And nowadays I can see some of interest from Bloomberg, Gates, and others to really help us to strengthen the regulatory body, but still no interest working on regulations in most of developing countries. People are much interested on working on supply chain because there are a lot of commodities that provide the HIV drugs, malaria, TB, and drugs, but there is no interest, much interest and appetite to support a country's regulation and regulatory bodies. That should be the next advocacy and a big movement in the country, not only for tobacco and alcohol, but also the quality of drug and AMR, antimicrobial resistance, and others are emerging. So that's the need and support that we really want to get in the future.
Endorse. Okay, well, thank you to everybody who came, everyone who's watching online, and to our panelists for an excellent discussion. So thanks. Congratulations to the task force. Don't forget to leave your